A local mom is out with a warning about kids with allergies. She says her son could not access his life-saving EpiPen while in after-school care.
Yeah, it's a problem. News 6 anchor Lisa Bell looked into this and is here now with the warning every parent needs to hear. Lisa?
That's right, Matt and Ginger. This mom assumed that since her son's school was notified that he has severe allergies, the aftercare program at school would also be aware and could administer his EpiPen if needed. Turns out that is not always the case. But I discovered a new proposed law in Florida could change that.
So you pulled this one out?
6-year-old Lincoln Isler practices how to use an EpiPen. The first grader has life-threatening food allergies.
Tell me, what happens if you eat some milk or cheese?
My throat will start closing up and I need help getting an EpiPen even though I can do it myself.
When Lincoln started kindergarten at Aloma Elementary, his mom, Sherry, says she filled out all the paperwork at school so staff there would know about his condition and life-saving medication.
And then on the first day of school in the morning, I went to drop him off and I asked the caregiver there from the before and after school care program who would be responsible, like what do they need to know? And she just looked at me and she said, like, we don't give EpiPens here. We don't have any training.
Sherry was terrified. She then found out Orange County Public Schools outsourced most before and after school programs to third-party vendors, and the training requirements varied from school to school.
Kids are eating breakfast there as well as after school snacks, and if nobody's trained on recognizing signs of an allergic reaction for him and giving him his EpiPen if needed, then he's just not safe.
An OCPS spokesman told me beginning in September of 2023, they now require that training in all before and after school programs. But Sherry wants to get results statewide. I checked. According to the Centers for Disease Control, at least 14 states require some sort of anaphylaxis training for school staff. Florida is not one of them.
And when you start investigating it, you realize that we're kind of behind.
State Senator Linda Stewart is sponsoring the Anaphylaxis in Public Schools bill. It would require each district to adopt an anaphylaxis policy, train appropriate school personnel, and at least 50% of staff in before and after care programs.
How difficult do you think it'll be to actually get this bill passed?
I don't think it would be that difficult. I don't see it as a partisan issue because it's a safety issue for our children.
Delaying or failure to use an EpiPen can have deadly consequences. I searched national guidelines. Both the CDC and the American Academy of Pediatrics recommend anaphylaxis and EpiPen training for school staff, which could help millions of children. Sherry says witnessing her own son in distress at home highlights the need for trained staff in all schools.
And just the look in his eyes, it was so scary. And so yeah, I had to give him his EpiPen, and he was scared of it because it's a needle. He knew how to do it, but he was scared too because of the needle. And thank God I was there.
Now, we checked other school districts across Central Florida. Osceola, Seminole, Sumter, Marion, and Lake all use trained district staff. Volusia and Flagler counties use some third-party vendors who are not trained. We are still waiting for a response from Brevard County.
This is shocking that it's just not policy countrywide because kids have so many allergies these days. Okay, so what does the training entail and what's the liability of staff?
Yeah, so Sherry, by the way, who's also a nurse practitioner, tells me the training for this is available for free from several food allergy organizations. She says it takes just minutes to complete. By the way, epinephrine, it's a naturally occurring enzyme in your body. So if you administer it to someone who's not actually having an allergic reaction, it really is just harmless.
Oh, so there's not much liability if you did it at the wrong time.
Yes.
Wow. It's a good thing we
It's
haven't
just costly because it's $600, so a lot of people are hesitant to use it.
Oh, that makes sense.
Yeah.
All right, Lisa Bell, interesting report. Thank you.
Thank you, Lisa.